Hello everyone, welcome back to my channel. This is Dr. Zina speaking. Today we will be speaking about what is the difference between apexification and apexogenesis. But before we continue, make sure to subscribe down below for more and more videos. Apexification is a procedure that is used to stimulate root development or closing of the root end. What do I mean by to stimulate root development? Which means that if we have an open apex, what do I mean by open apex? When the apex is not completely developed, the root is opened down at the apex area. So in order to stimulate the closure of the apex, we need to do apexification procedure. As I said, the apexification is indicated for a tooth that has an open apex. So this is the picture and periapical x-ray that is taken for a tooth in which you can see the apex is opened, which means that the root is not fully developed. Or in other words, the roots have been eroded away by a process known as resorption. So what is the resorption? Make sure to watch my previous videos in order to know more. Now you might ask me, what material is used for the apexification procedure? MTA, mineral trioxide aggregate, has gained widespread popularity for the apexification procedure. It produces apical hard tissue formation with significantly greater consistency than calcium hydroxide. MTA is a biocompatible material that can be used to create a physical barrier at the apical area of the tooth. So this is what do I mean by an apical barrier that is formed at the apex of the tooth. Barrier meaning that we need to close the root area, forming a barrier at the end. What materials other than MTA can be used for the apexification procedure? Calcium hydroxide, tricalcium phosphate, dentine chips, calcium phosphate ceramics, and hydroxyapatite all can be used for the apexification procedure. Calcium hydroxide is the most common and traditional material employed for inducing apexification procedure until now. But if you want me to be honest with you, MTA is way better than calcium hydroxide. Why is that? Because the MTA is less toxic. Because it is less toxic, it does not cause pulpal inflammation. So less pulpal inflammation capping compared to calcium hydroxide. That's why I prefer for the apexification procedure to place an MTA rather than calcium hydroxide. Now here is a periapical x-ray that was taken for one of the patients. As you can see, the patient is having an open apex. So the treatment that was suggested is to do an apexification in order to close the roots. So we need to close the roots. Of course, basically, when you do the apexification procedure, it will not only need one visit. Multiple visits are required. In addition to that, the pulp capping material that was placed is not calcium hydroxide. It was an MTA, mineral trioxide aggregate, because it is less toxic, as I said, and therefore causes less pulpal inflammation for the patient. Then, after 6 months, we recall the patient back again in order to check the apical healing. It was very good. Of course, basically, the apex won't be completely closed within 6 months. It, of course, differs with each stage of the tooth development. It depends on the stage of the tooth development, depends on the root development, how much it is developed. All this basically determines how much time does the apex need to close. Now let's talk about what is apexogenesis. It is a procedure where vital tissue within the tooth is maintained to facilitate continued development of the immature root. What do I mean by vital? Now, apexogenesis is indicated for a teeth that is vital, which means that you know that the pulp is divided into two portions. We have the coronal pulp and we have the radicular pulp. In here, the radicular pulp is normal, it is sound. Here we are concerned about the top part of the pulp, which is the coronal part of the pulp is inflamed in this apexogenesis procedure. So we can say apexogenesis or pulpectomy. Yes, that's right. Because we are only concerned about the coronal part of the pulp, not the radicular part of the pulp. Here, the radicular pulp, it is not inflamed, it is vital, but the coronal is the one that we are concerned about. Here is a picture for the steps of the apexogenesis procedure. So after we determine the diagnosis of our patient, of course the diagnosis is not, you cannot say the patient is having irreversible pulpitis and then you do for him apexogenesis. That's not right. Because if the patient is having irreversible pulpitis, you will do apexification if he's having an open apex, and you will do root canal treatment if he's having a closed apex. But in this case, the apexogenesis is indicated for a tooth that has symptoms of reversible pulpitis, where only the coronal portion of the pulp is inflamed. So we need to remove the coronal portion of the pulp. After you remove the coronal portion, you place an MTA in order to stimulate the development of the pulp inside the tooth with an open apex at the end. To be honest with you guys, MTA is the optimal material for both procedures, apexogenesis and apexification. Historically, a long time ago, they used to use calcium hydroxide because it is cheaper than the MTA. But nowadays, I prefer for you to use an MTA because it is less toxic and causes less pulpal inflammation than the calcium hydroxide, or also referred to as the dical. Now, here's a table that I created. You need to memorize it just like your name. Just like your name exactly, in order to make your life easy and simplified. Now, if the patient is having reversible pulpitis, you need to check whether the tooth is having open apex or closed apex. In either ways, whether he's having open or closed apex, the treatment that will be suggested by us will be apexogenesis. What do I mean by apexogenesis? You can say it is depulpectomy, or you can say direct or indirect pulp capping material. This is what do I mean by apexogenesis, because we are not concerned about the radicular portion of the pulp, we're only concerned about the coronal portion of the pulp. So you can say pulpectomy, or you can say direct pulp capping or indirect pulp capping procedure. That is regarding the patient if is having symptoms of reversible pulpitis. And what is the symptoms? You might ask me right now, what is the symptoms of reversible pulpitis? Number one is pain on hot and cold. Whenever I drink cold drinks, whenever I drink hot things, I feel pain. And not only that, sharp pain, but it is not lasting. Sharp pain that is not lingering. If it is not lingering, like if you are having a severe pain that is not lingering, okay, like not, it will not stay for more than 9 seconds, then it will be reversible pulpitis. More than 9 seconds, it will be considered, on the other hand, irreversible pulpitis. Now, in case of irreversible pulpitis, the situation will differ. If you have an open apex, you can do either apexification or apexogenesis. Very important. Now, for the apexification, as you know, we need, in order to close the roots, if the coronal and the radicular portion of the pulp is inflamed, you do apexification. Don't think about anything else. The apexification procedure can be done by either calcium hydroxide or MTA, and as I said before, MTA is more preferred than the calcium hydroxide. Now, in another situation you have, if the coronal portion only is inflamed, but the radicular portion is perfect, nothing's wrong with it, we can do apexogenesis. We can just do regeneration for the tooth in order to stimulate the formation of the vital tissue at the end, which is the pulp. The apexogenesis can be done via the triple antibiotic paste. Triple antibiotic paste, MTA, 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 that's it. Now, If the patient is having closed apex, of course, the standard treatment will be conventional root canal treatment will be done for the patient if the patient is having a closed apex. So what is the difference between apexogenesis and apexification? In apexogenesis, as I said, the pulp is vital. Which part of the pulp? The radicular portion of the pulp is vital. In comparison with apexification, the pulp is necrotic. So it is another name for root canal treatment is apexification that is done in an open apex. Now, in apexogenesis, as I said, only coronal pulp is removed and the radicular pulp will remain intact. So we remove the coronal pulp and place an MTA in order to stimulate the formation of the vital tissue. Whereas in apexification, as I said, it's another name for root canal treatment, but it is done in incomplete root development of the teeth, like open apex or immature teeth, in which the entire necrotic pulp tissue is removed. So both the coronal and the radicular pulp will be removed under the name of apexification. In apexogenesis, a hard setting calcium hydroxide is applied over the pulp tissue. Why is that? In order to stimulate the formation or the development of the vital pulp tissue. Whereas in apexification, non-static calcium hydroxide will be used. Non-static calcium hydroxide or MTA can be used in order to close the root at the end, stimulate the development of the root in order to close it at the end. In apexogenesis, a normal physiological root development will take place, completing the root length. That's why we need to add these materials inside. We need to do triple antibiotic therapy inside the root in order to have a normal physiological root development to take place. Whereas in apexification, a calcific barrier will be formed by us. We need to place an MTA in order to form this barrier at the end. Whereas in the other hand, in apexogenesis, complete RCT is not necessary. Why is that? No need to do a root canal treatment, a full root canal treatment for the patient under the apexogenesis, because as I said, it is only pulpotomy or direct pulp capping or indirect pulp capping, but it's not root canal treatment. Whereas the apexification, root canal treatment is required. So you need to complete all the steps of the root canal treatment under the apexification procedure. That is the main differences between the apexogenesis and apexification. Thank you all for watching my video. If you enjoyed, don't forget to press the like button down below, comment down below if you have any questions, and subscribe for more and more videos.